Joining me now is Georgia Senator Reverend Raphael Warnock. He's also the senior pastor of Atlanta's historic Ebenezer Baptist Church, once led by Dr. Martin Luther King Jr. Senator, we've got a lot to talk about, including the legislation that's before you and your colleagues in the Senate. I want to start with this remarkable sort of inversion we've seen, the federalization of National Guard troops over the objection of a governor. 4,000 set to be deployed throughout California, active duty military Marines in California. What do you think about the president's actions?
Well, listen, I come from the civil rights tradition. As you point out, I'm pastor of Ebenezer Baptist Church, where Dr. King served. But those guards, in that case, the National Guard was sent in and summoned, in a sense, by a campaign that was trying to bring us together. Donald Trump is focused on trying to tear us apart. And it's no mistake that he is using and really abusing on this week in which we celebrate the anniversary of the Army. He's using, if you will, the symbolism and the uniforms of our service members in a campaign to do what he's been doing for 10 years, and that is to convince us that we are at war with one another. That's really his project. He's trying to divide us because people who have no vision traffic in division. He's trying to divide us in order to rule over us. That's the way dictators and autocrats, that is their modus operandi. We can't be distracted because right now he's trying to pass his so-called big, beautiful bill that will literally create a context in which as many as 16 million Americans could lose their health care, and almost everybody in America is going to see their health care costs go up, even if you buy private insurance. That's what we're not saying enough. We were focused on this back in 2017. By the way, I was here in 2017 as an activist pastor in the tradition of peaceful protests, and protests must always remain peaceful. I was engaged in acts of civil disobedience. I was arrested in the very building that I now work in as a senator representing Georgia, fighting for health care. And all of these years later, I intend to continue that fight. Several years ago, it was as an agitator. Now I'm blessed to be a legislator to translate my protests into public policy to stand up for health care, which is a human right.
One thing I heard in what you were saying there, and I've read numerous political analysts say this and reporting on the White House, that they relish this fight over immigration law and order. And I think they may be wrong on this. I want to be clear. I don't think they have some magical rhetorical trump card. But they would choose that over talking about a bill that's going to cut taxes for people that inherit $20 million homes from their relatives and kick 14 million people off Medicaid, because that's a hard thing for them to kind of message around.
Oh, it's very unpopular. And they know it. Here's what they also know. They claim that they were looking for waste, fraud, and abuse. There's not enough waste, fraud, and abuse to justify $800 billion worth of cuts out of Medicaid. And here's why I certainly know this is the case, because on the night of the vote-a-rama, when they were putting forth this project, the initial step, I put forward an amendment that simply said, will you affirm that you will not cut anybody off of coverage, that you will not be cutting coverage? Of course, that amendment was voted down because they know that the math doesn't work. It's clear what they're trying to do. With these work reporting requirements, they are using the Georgia model. And I know something about that model because I live in the state of Georgia. I represent Georgia. And Georgia is the only state right now that has these onerous work reporting requirements. And let me be clear, it's not work requirements, it's work reporting requirements. And the goal there is not to incentivize work, it's to kick people off of their health care. If you've got to certify, not annually, but every 6 months, imagine that you deserve or need this health care. Every 6 months, you've got to go through all of this red tape. We've seen what that does in Georgia. It does not incentivize work. It kicks working people off of health care, which is why the governor has signed up 7,000 or so people in the Medicaid program in Georgia through his pathways to coverage, which he ought to call roadblocks to coverage. They are now trying to take this failed Georgia model and then spread it throughout the entire country. And what you ought to ask yourselves is, why are they doing that? It's because they want to kick people off of health care. They want to make it hard for states that might want to expand to expand. And why are they doing all of this? In service to a tax cut to billionaires, the wealthiest people in the country, while at the same time adding $3 trillion to the national debt. It is morally wrong. It is fiscally irresponsible. It will be a drag on our economy. I think it has the potential of pulling us into a recession with all of these other awful policies, this 10% tax on everything through the tariffs. And Donald Trump would rather put on a show in Los Angeles than do what people in Georgia who voted for him hired him to do, and that is to take their costs down. Every single day, he's driving up costs, driving up the temperature in our nation, trying to divide us because he has no vision for the country.
Senator Raphael Warnock of Georgia, thank you for your time tonight, sir.
Good to be with you.